Gandang gabi po sa inyong lahat. We are joined tonight by two of the WATERWALL Project's health practitioners. We have Sumaya, who is one of the volunteers for today's session. Sumaya Sayed Ann is an international medical graduate currently working in obstetrics and gynecology. She has been passionate about women's health since she was 15. Growing up in India, she knows how little they pay attention to their own health, which has contributed to her choice of becoming a women health advocate to pursue a career in obstetrics and gynecology. Say hello, Sumaya, to our...
Hello, everyone.
Yes,
nice being here.
You. Thank you for joining us tonight. And
thank you, Marissa.
We also have the pleasure of having Dr. Yan from originally from China. She's a migrant from China. She loves her job as much as eating rice, according to her. And she is a doctor, a GP in Melbourne, and she will be facilitating most of our discussion tonight. Good evening, Dr. Yan.
Good evening, everyone. Thank you very much, everyone, for joining us today.
Thank you. And we are also joined by Elizabeth from the Sudanese women's community. Thank you for participating tonight. And of course, our volunteers from Gawad Kalinga. We are live streamed in our Facebook page, GK, and also in Good Vibes Pilipinas. So if you have any questions, feel free to put it in our comment section and we'll ask our health practitioners. So at this point, I'll turn over the camera to you, Dr. Yan, and share away.
Thank you, Marissa. So I'm sharing my screen and you can see the screen now, is that right?
Yes.
Yeah, okay. So again, good evening, everyone, and welcome to today's session on women's health. So Sumaya and I will be facilitating the session today. So we both are from the WATERWALL project, and just a little bit of introduction about the WATERWALL project. It's a not-for-profit organization providing free health education sessions to people from migrants, refugee, and asylum seeker backgrounds. And we are absolutely passionate about it. And today's topic is women's health. So there are a lot of things that we can talk about women's health. And our lovely Marissa has already gathered some questions for us before the session. So we will try to focus on some areas of women's health. We'll be talking about cancer screenings in Australia. We'll be talking about general health, including eating, exercising, and also mental health. And we also would touch on postnatal depression as well. So we will be providing some general advice, but we can't really answer very specific questions. So if you have questions about your health or your family member's health, a better way to find the answer or talk to doctors would be talking to your own doctors, because they would know you much better. And we welcome questions, so feel free to interrupt us, and we'll be monitoring the chat box in real time and answer the questions to our best knowledge. Yep, so I will just hand over to Dr. Sumaya to start today's session.
Hello, everyone. I'm Sumaya, as you all know by now. We're going to talk about some basic things, and we'll go into the cancer side of the things in a few minutes. These are just some basic questions that I would obviously want to ask you guys. And I don't know, Marissa, if people are able to respond to these questions that I'm going to ask, or should I just talk? Is that something that you'd prefer?
Yes.
Do you think that they would be able to answer?
That will be difficult because
there'll be
a lag time.
Not everyone is on the session. Yeah. Okay. Sure. So what do you guys like? Obviously, I just want to mention that there are certain chronic conditions amongst women, and some of them are quite common. I don't want to basically divide it only into men and women, because a lot of conditions in women are similar to the ones in men. For example, diabetes, which is very common, hypertension is very common. Apart from that, just general obesity, which leads to a lot of other health issues, is quite common. What do you have to say, Yan Yan, about some of the common chronic conditions that you know in women? Something that's very common?
Yeah, so I think you have already mentioned a few common things. So heart-related problems, including high blood pressure, high cholesterol, and also diabetes is a big one. And the weight, either overweight or underweight, are pretty common.
Yes.
And I think another common thing in women is osteoporosis after menopause.
Yes.
That's definitely more common comparing to men.
Yes, arthritis as well. I think that is quite common in women. And yeah, so let's get into the cancer screening part of the things. So there are 3 types of cancers we'll be talking about today in terms of what Australian health system advises us to do for screening these type of cancers. The most common one for the females would be a cervical cancer screening. So cervical cancer is a preventable form of cancer. And because of what we do in Australia, thanks to the cervical screening program and the HPV vaccination, Australia has one of the lowest rates of cervical cancer in the world. Now, what we generally advise is every female between the age of 25 to 74. Initially, this was called pap smear, but we don't do pap smear anymore, and it's a cervical screening test. So every woman between the age 25 to 74 undertakes this routine cervical screening test, and it is done every 5 years. It basically tries to detect the presence of a virus, which is the HPV virus. And if it is there in your system for a long period of time, it can go on to form cervical cancer. It's ranged at approximately up to 10 years. So if it's in your system for that long, then there's a high chance that you will develop cervical cancer. So it's a good screening test to do. That's why we are not doing it more frequently than every 5 years, because it takes up to 10 years for it to get into a cervical cancer form of the things. Now, this test is available on the Medicare benefits schedule as well. And starting from today, as we speak, all women between 25 to 74 years of age will have a choice of doing the screen by themselves. So, sometimes it can be quite uncomfortable going to the doctors, using a speculum and doing it. I think the fact that they've now given us a choice of doing a self-collection of the sample is a really good breakthrough to this whole thing. And this will potentially remove some cultural and personal barriers that a lot of women have from the screening test itself. And I think, yes, that's about it for the cervical cancer screening. I'm trying to keep it really short, but summarizing everything that is important. So every 5 years, 25 to 74 years of age, and there's a self-collection available. That's basically the highlight of this whole topic. Is there anything you wanted to add on to this, Yan Yan, or you were happy with whatever I said?
Thank you, Soraya. That was a very good summary.
Yes.
And I guess just one thing I want to add is whether you have had a HPV vaccine or not, you still need to have cervical cancer screening.
Yes, absolutely. So that's about it for the cervical screening. I think the next is the breast screening test. I think Yan Yan has put up a very good image here, which tells us what the symptoms would be like. And that's exactly it. So every woman needs to look out for symptoms for skin changes, nipple discharge, general pain in the breast that is abnormal for you. We can expect some pain during the ovulation time and all of that, but you'd know when it's not similar to your monthly pains, and some changes in the shape of the nipple. And this will basically, you will be able to do it even standing right in front of the mirror and look at your breast in all positions that they have shown in this picture. So this is a really good picture, Yan. And is there a way we can share it with everyone so that they know that this is how they can actually every month probably look at themselves in the mirror and just do a self-examination as well?
I think I can send some information to Marisa, and
yeah, that would be great.
For us to circulate it around.
Awesome. And just with the breast screen, there's an initiative by the Australian government as well as the state and territory governments that aims to reduce illness and death from breast cancers by detecting the disease quite early in stage. So now what we are doing is women over 40 can have free mammograms every 2 years. And that is a good breakthrough. So everyone over 40 years of age can have mammograms to detect any forms of cancer or any forms of abnormality in the breast, basically. And most of the times, the risk of breast cancer increases between 50 to 74 years of age. And that's when a lot of people start getting, I guess, letters or emails from their GPs to say that it's time to go ahead and do a breast screening. And that's something I feel is very, very important. If you are at a high risk category, this can start as early as 40 years of age, I said. But if you're not, it would be between 50 to 74 years of age. Is that right, Yan? I think that's what I've read in the research.
We start from the age of 50 every 2 years.
Yes.
But in certain population, if there are some risk factors, so we can start from 40.
Yes, and this is free of charge, is that right?
Yes, yeah, from 40, free of charge. And
yes.
I think in certain very high risk group, we start even earlier than that.
Earlier, okay, that's really good to know. So that's one thing. So we have two things sorted by now. One is the cervical cancer screening, and the second one is the breast cancer screening. And the breast cancer, the age group is 50 to 74, unless it's high risk, then even earlier. Okay, and what you do is firstly your own analysis by looking into the mirror, and the second thing that is important is the free mammogram that you're getting every 2 years, which I think is a very good initiative. Okay, let's hop on to the bowel cancer screening. Now, bowel cancer screening is important for both men and women, but just to let you guys know that the screening for bowel cancer itself can reduce death rates from the disease between 15 to 25%. So I think that's a very massive number if we actually calculate. I think that's great. And bowel cancers usually would develop like without any symptoms unless it's growing really fast or unless it's grown to a major part. So a lot of times people would not find out about the bowel cancers in a very early stage. And I think the screening plays an important role here to prevent to prevent the progress of the disease. And in this screening test, since 2020, all Australians between the age of 50 to 74. So I think 50 to 74 is the number that we should keep in mind. And I think to make it easier, they've made everything quite 74 is the highest like age group that they've said that you can get free screening tests every 2 years, and you're invited. In fact, again, most GPs do send in invites to say that it's time to get your screening test again. So what they basically do is they provide you with a free national bowel cancer screening program kit. they send it to you at your home. So you don't really have to go to someone to do it. You get it at home, and then it helps you detect any spots of bleed that you would generally not be able to see in your bowels. So a very small amounts of blood that can leak from these cancerous growths can pass into your feces. And once the small bleed is detected, you can always investigate it further when you know that there's something going on. So talking to your GP and then discussing further. And as I said, it has decreased the death rate from the disease by between 15 to 25%. So I think that's important to note, that these 3 screening programs are free of cost and everyone can actually use it for their own benefit. I think that's really recommendable. Otherwise, these could be quite expensive if they were not free of cost, I think. Is that right, Yanya?
Yep, that's right. So so the 3 cancer screenings are free for eligible people, so the right age group.
Yes.
Yeah, and we would love people to do the screening test, because that's the purpose of screening, that
Yes.
we find the disease early on and we treat it, and
Yes.
that would offer a much better outcome for everybody.
Yes. Awesome. So I'm done with my screening. Yan Yan, handing over to you.
Thank you, Smaya. That was great.
Thank you.
So I think we have talked about the 3 types of main cancers that we actually screen for. But both men and women can have a lot of more other medical conditions, and some we have already mentioned, the heart problems, diabetes, things like that. And then many of them can be chronic, which means they can be with us for a long time and we need to manage them for a long time. So then I often get asked, oh, okay, so right now I've got the disease, I need to take tablets, but is there anything else? Is there anything I can do to prevent this from happening or to prevent this from becoming worse? And the answer is yes. There are a lot of things we can do to look after our health, to delay the onset of certain medical conditions, or even to prevent some medical conditions from happening. And as a GP, we love this preventative medicine. So now we are going to talk about a few things that we can all do to look after ourselves. So the first one is something that we do every day, many times a day. It's eating. So every group has its favorite food, and I'm Asian and I love rice. I grew up with a lot of rice in my plate, but I guess later on I realized probably I was having a bit too much rice. So when we look at this picture here, we have this wheel in the middle with the 5 groups of food. So every day we need to choose from all these 5 categories of food. So the orange one here on the left upper corner is grains. So that's everything made out of grains. That includes bread, pasta, noodles, rice, of course, and a few other things. So in terms of grains, it gives us energy, and we need it. And the whole grains are better than the more refined grains. So for example, brown rice would be healthier than the white rice, and the whole grain bread is a bit healthier than the white bread. Yeah, so I think we can definitely incorporate some whole grain food in our meals. And for example, I know we will love rice, so we can mix the brown rice with our usual rice. So we are having a healthier meal when doing that. And the next big group of food category is the green one here, and that's our vegetables. So we need to have a fair bit of vegetables every day. So we say 5 serves vegetables. And I understand sometimes it's a bit difficult for us to know, what is actually 5 serves? And usually I would say if you have a plate, probably half of the plate or at least 1/3 of the plate should be filled with veggies. And that's what we need. It's very good if we can have vegetables of different colors. So green, yellow, orange, purple, the more colorful, the better. And another group of food here is the one in blue. So that's our protein. So it comes from all sorts of meat, eggs, fish, chicken, and the legumes as well. So that gives us the very important blocks to build up our muscles to become strong. And also that's important for our immune system and for a lot of functions of our body. So when we think about meat, then we also tend to think about the fat on the meat. So then I think advice is we reduce the fat, in particular the animal fat. So we try to have lean meat. Then in that way, we can have the protein. We also have the iron from the red meat. At the same time, we're not having as much fat from the meat. And the next part is the one in purple. This is the dairy product, which is also very important. And that's also something that I realized I was not having enough in the past. So the dairy product is very rich in calcium, which is very, very important for our bones. And as women, we tend to lose a fair bit of a bone density after menopause. And the calcium from the dairy product can help us to maintain the bone density for longer, and also to reduce the speed of the loss of the bone density. So how much dairy we need? We actually need a bit more than what we think. So on average, we need about 1,000 milligrams of calcium every day, and that's about 3 cups of milk, or 3 tubs of yogurt, or 6 slices of cheese. So that's a fair bit of a dairy product that we need. And I think many of us are not aware of that. So next group, the 5th group of food is a fruit. So fruit is also an important part of our diet because of the fiber and also all the vitamins they provide. So we would love people to have 2 serves of fruits every day. So 1 serve of fruit is about a medium-sized apple. So that's about 1 serve. So 2 serves a day are part of the healthy diet. And when we talk about eating, drinking is also important. And the best drink is just a plain water. And we're very lucky here in Australia that we can just drink from the tap. So tap water will be your best friend in terms of drinking. So then when we talk about healthy eating, then sometimes we also think about smoking and alcohol because that's something that we put into our mouth as well. And I think for smoking, many of us already know there's no safe level in terms of smoking. So smoking has been found to be associated with a lot of cancers and a lot of other medical conditions, including heart attack, lung disease, things like that. And even if you don't smoke, but someone else in the family smokes, the secondhand smoke can also cause harms as well. So for example, children who are exposed to secondhand smoke are more likely to have asthma, and the babies are at higher risk of the sudden infant death syndrome as well. So the safest thing to do in terms of smoking is no smoking. And alcohol-wise, that's a sort of a cultural thing, a social thing to drink a little bit every now and then, and it's probably okay. But drinking too much is not very good for our health either. So the recommendation is that on average over a week, it's better not to drink more than 10 standard drinks. And sometimes people can get a little bit confused between the standard drinks and the drinks. Some people may feel like 1 glass of wine is a drink, is 1 drink, but actually it's a bit more than 1 drink. So imagine you've got a bottle of wine in front of you. That's about 7.5 drinks. So 7 to 8 drinks in a bottle of wine. So if you are sharing a bottle of wine with another friend and you finish the whole bottle together, then each of you has already had about 4 drinks. And that's the maximum for a single occasion. And I think another important thing for women to know is there's no safe level of alcohol during pregnancy. It is related with fetal alcohol syndrome, which is a congenital defect of the babies. So 0 alcohol during pregnancy is the safest thing to do. So Sumaya, anything to add on the smoking, drinking, or eating?
No, I think you said really well about the vegetables thing, because we always think only green leafy vegetables, but adding a lot of colors to food is also quite beneficial. I think that was great. And yes, regarding the alcohol during pregnancy, I think if you've had a lot of alcohol, even leading into pregnancy, we just need to make sure we let our doctors know so they know what things to be looking out for in the upcoming scans for the baby. So just disclosing everything to the doctors would be very important. I think, yeah, but you've covered everything pretty well, Yan. Thank you.
Thank you, Sumaya. That was a really good point. Okay, so we carry on. So the next thing we can do to look after ourselves is exercise. It may look very simple. You may think have a casual walk is exercise, but I think we always encourage people to do a bit more than that. So exercise is good for our physical health, for our mental health, because going out and getting about is really good. And also it helps us to maintain the strength of our bone, our joints, and it's part of our socialization as well. So that's definitely something that we can all think about. So in terms of what type of exercise we should do, or how much we should be doing, then yes, there is a guidance. So we should probably do about half an hour of exercise 5 days a week. So that's in total 2.5 hours a week. So what we should be doing then, you can do any exercise, but we really want people to get the heart rate up a little bit when they're exercising. So an easy way to figure out whether you are exercising enough is if you are doing this exercise with another friend, then you probably would find a little bit challenging to maintain a conversation. So you feel like you are a little bit short of breath, and that's the right intensity. So if you can still maintain a conversation pretty well and talking with each other, smiling, then that probably means you are not exercising hard enough. But for people who are not doing regular exercise, then we would suggest them to start from slow and small. So just do a little bit, for example, 5 to 10 minutes walk to start with. And after you have built up the strength and the tolerance of your body, then you can gradually increase the intensity of your exercise. And another type of exercise, I think a lot of exercise we'll talk about is what we call aerobic exercise. So like walking, jogging, yoga, Pilates, swimmings. Another type of exercise, we call that a weight-bearing exercise. And that usually means we're carrying something, carrying some load. So it can be our body weight. Like for example, running, we're carrying our own body weight. Or if we lift a dumbbell, we're carrying that dumbbell as well. So that weight-bearing exercise is good for our balance and good for maintaining our bone density as well. So we would love people to do weight-bearing exercise twice a week if possible. And I think that's very important for women because we tend to forget that part, myself included. We tend to love yoga and running and tend to just forget about weight-bearing exercise. but at the same time, we're at a higher risk of having osteoporosis. So I think that's something we can definitely think about. So like skipping the rope is a type of weight-bearing exercise. Just a simple light dumbbells lifting a weight-bearing exercise as well. So that's that. Yeah, that's about exercise. And the next bit is about looking after our mental health. So we are still in the pandemic. It's just unbelievable. I think 2 years ago, we said, oh, hopefully it will be over by the end of this year, but 2 years later, we're still in there. And I think COVID has affected a lot of people's mental health. But even without COVID, life has a lot of stresses. And we now live a very busy life, and people can get stressed out every now and then. And that's normal. And I think when I talk about mental health with my patients, then I tend to say it's normal for us to have a range of emotions. It's totally normal for us to feel sad, feel angry, feel disappointed, feel distressed every now and then. And that's just a part of the life. But I think even if there are stress, we still can do things to make us more resilient to the stress, which means we can recover quickly from the stress that we face, and we can go back onto our usual daily activities. So what do we do to look after our mental health? Healthy eating is one thing. We have just mentioned about that. Exercise is also one thing, and there are good evidence to suggest that eating a balanced diet and doing regular exercise can help with people's mental health. And other things we can consider is to stay in contact with our family and friends, so we have someone to talk to if we are going through a difficult time in life. And another thing we can think about is some relaxing practice. So I know a lot of people are doing mindfulness. And I know children here in Australia, they started to learn about mindfulness from a very early age, and that's just simply amazing. So mindfulness is a really good practice, and that brings our mind back to ourselves to focus on the present, and I love it. So a very simple way to do a little bit of mindfulness practice is to use our senses. So when we are having strong emotions, then we just need to take a big breath to bring our mind back. And we can use our eyes to spot 5 things around us and name them, and hear 4 different sounds using our ears and name them. And we can use our nose trying to smell something, and also use our mouth and tongue to taste a flavor and name it. At the same time, we can also use our hands and feet to feel something and name it. So by doing that, we are quickly sort of dissociating ourselves from the strong emotions that we're experiencing. And that gives us a better chance to calm down and to rationalize our thoughts again. Yeah, so that's just a sort of a very simple tips on our mental health. Anything to add on, Samaya?
No, I think you covered everything. That was great, actually.
Yeah, thank you. So then, yeah, we'll just carry on from mental health to talk a little bit about postnatal depression. Yeah, so back to Samaya again.
Okay. Postnatal depression means depression after childbirth, but I just want to mention that a lot of women go into the depression phase much earlier than even that. So even during the pregnancy, sometimes it could be quite overwhelming, and the feelings could be like really, really strong. What happens after your delivery is that there are obviously a lot of hormones, and the hormone levels of estrogen and progesterone is quite high in the first few hours and all of that. So you may start feeling a lot of different things happening to your body. You may start feeling restless, you may start feeling moody, you'll feel sad, hopeless, you may cry a lot, you may have no energy, you won't feel like doing anything or going out, you may have troubles with your memory and all of that. Okay, but there's something called baby blues or postpartum blues, and there's something called postpartum depression. So with postpartum blues, you'll still have all of these symptoms, but you'll notice that after you give birth and a few days later, it just starts to get better. But if your symptoms are staying longer than, for example, 1 or 2 weeks, we generally give it for about 2 weeks, but we would expect the postpartum blues to start getting better in the first 5 to 7 days or so. But if they stay quite long and probably more than 2 weeks for about a month, and then we would recommend that you just visit your GP and get yourself checked, because that could show that it is not just any blues and it's not just a normal thing to happen. Now, to be honest, where I come from India, where the term depression is quite a taboo. I don't think anyone really thinks of it as something important. They either feel that you're mentally unwell, so people will start thinking that you're crazy, or otherwise they'd be like, that doesn't mean anything. We've gone through pregnancy. So the elders will talk to their younger generations and say that, why are you behaving this way? This is quite normal and everyone has gone through this phase. I don't think you need to overreact and this and that. And I think that leads to a lot of people not sharing what they're actually feeling, because there's no one to listen to them or no one to hear them. So it's really, really important to talk about these things, because just as important as it is to talk about cancer, depression is quite real. We've been starting to talk about it at this stage, whereas this has been going on forever. But I think now people have been coming out and speaking about their mental health, and that is quite important. Now, with the postpartum depression, a lot of women, once it's diagnosed, and there are few things that they can do which could help them. A lot of people are just okay with, after doing some talk therapy with their GP or a psychologist or whoever they're referred to, and then learning the strategies similar to what I think Kanyan said. But I think for postpartum depression, if it's quite severe, they start with more focused kind of talk therapy with the patients. And then after that, if that's not working out, they would also need to sometimes put you on antidepressants and medications that are safe during breastfeeding and all of that. So that will be discussed like more in detail if any of you have it. But what I am trying to say is that it's not normal for you to feel that way for 1 to 2 weeks after you've delivered, or even for months after you've delivered. It's not something that you should think about as, oh, everyone's going through it, so I shouldn't make a big fuss of it. I think the earlier you call out, the better it is for management of postpartum depression. And speaking about mental health at this stage, especially for women, because we as women feel that it's our duty to be strong and not to express it, because we have a lot of people to look after. We have our partners, we have our kids and all of that. And probably this is going to hamper my relationship with them, or I don't know what he's going to think about me, what she's going to think about me. I think it's extremely important for everyone to know that that is something that needs to be voiced out before it gets worse, because the suicide rates are increasing, and if we don't talk about it more frequently, it's going to be a norm in a few years that women are committing suicides because of a postpartum depression. But I think now that we are starting to speak up about it, there has to be a few things that everyone needs to keep in mind, and we shouldn't go beyond that limit and try to stretch ourselves to an extent where there's no coming back. I think that is important. So yeah, that's all I think from the postnatal depression point of things. Yanan, is there anything that you thought would be beneficial?
Yeah, I think you covered it really well, and that really good points there.
Yeah.
Thank you, Yan Yan and Sumaya. At this point, we'll entertain some questions. Patsy raised her hand first. So if you can unmute yourself, Patsy, and ask your question.
Yeah, it's hello, Dr. Yan Yan and Samaya. Thanks for all the information. In the first part about bowel cancer screening, um, is that the one that you're saying that it's free? You go to your GP, is that right? How is that compared to the one that like you get you register with the bowel council, and it's the same thing, you do it yourself? Because I did that.
Yeah.
Because I
It's-
used to do is that
Yes.
the same as the
It
colonoscopy?
is, no, it's not the colonoscopy. So colonoscopy is basically putting something with a camera inside your body.
Yeah.
This bowel cancer screening kit that I'm talking about, it's something that's sent in mail to your homes. And you basically, I don't know if the GP is driving that at this stage, Yan Yan, but maybe you can help with that. But it's basically a test that will help to check if there's any blood in your bowel. So it's something that you can do at your own home rather than having to go for a colonoscopy. And it's because it's a screening test, it's something that would eventually, if there's blood found or anything, you may still need to go for colonoscopy later on.
Okay.
It's something that you can diagnose earlier and at home, because I think a lot of us are generally quite skeptical about going for a colonoscopy if you've not had any procedures previously. And so this is a good starting point with just something that you can do easily at home. And it's different from the colonoscopy. It's just something in which you need your stools. You can do it at home. There's a testing kit which can test that if there's any blood. Is that right, Yan Yan?
Yeah. So it is mainly driven by the government. So a lot of people are getting that, or most of people are getting that in their mail. So they are sent out by the government after your 50th birthday. But some people somehow, for whatever reasons, have missed out of that kit or the opportunity, and they would come to GP and to say, I still need to do that. I haven't done that for a number of years. Then we also provide a similar testing kit, and it's also free of charge.
So it's just similar to the
Yeah,
one from bowel council that you
That's
receive.
right. Yep. It's essentially the same thing.
What about the colonoscopy? Is that also free? I know that's been. I used to do that because in the family we had a one
Yep.
sibling who died of colon cancer, but yeah, I had to pay. I had to pay for that.
So colonoscopy is a bit different. So it's not for everyone, or it's not recommended for everyone. So as a screening tool, so screening means you have no symptoms, you are perfect 100%, and we just want to see whether there's anything developing without knowing. So colonoscopy as a screening thing is only for people at high risk, for example, family history of bowel cancer, or family history of a certain other type of cancers, certain type of cancers. Or somehow you had a colonoscopy before and there was a certain type of polyp there, then you might need to have a colonoscopy every 3 or 5 years. And that depends on where you go to have the scope. So if you are referred to a public hospital for the scope with a valid medical reason, that's usually for free. But if you choose to see a private specialist for that, then there's a out-of-pocket payment for that.
Another question. In my previous experience with the colonoscopy, they haven't seen anything there, no polyp at all. And they said that I can do it like every 3 years and even, 4 years. Now that, because it's very uncomfortable as well in doing that with the preparation, can I just do that one in the bowel council, the test at home that you get from the mail? Because that's what I've been doing lately.
So I think at least you should do the bowel cancer, the stool test every 2 years at least. But in terms of whether you still need to have the colonoscopy, I think it really depends on your risk factors. And without assessing like your family history properly and your personal medical history properly, I can't really give you a recommendation. Do you still need to do the scope or not?
Then thank you.
Thank
I
you.
can just ask my GP about that.
Yes, that's right.
Thank you, Patsy. So, but what are the early signs of bowel cancer, Dr. Yan Yan? What should we be watching out?
It can be really tricky and challenging. So Sumaya has mentioned that we usually don't have a lot of symptoms during the early stage of bowel cancer. And that's why screening is very important. Because when the cancer is small, we may not have any pain. We may not notice any blood because the blood loss is so little. They can be tested, but we can't really see. And we may not notice any change of our bowel habits. So often we say, okay, if you have a change of your bowel habits, for example, you have been going to the toilet every day, once a day, very regular for many years, and suddenly you become constipated without no good reason, then we think about bowel cancer. It doesn't mean it has to be bowel cancer, but we think about it. But if that's caused by bowel cancer, then that usually means it's not early stage anymore. Yeah, and the people may lose weight, they may actually see blood, or they may see blood stool. Again, usually that's not early stage anymore. Yeah, so
we really have to,
yeah, you really need to do the
follow.
screening to actually catch the diagnosis early and to be able to treat it.
And just something that I could share is that one of my friends had her mom who had bowel cancer recently. She was a fit, healthy woman. She was around 52 years of age. She's not in Australia. So obviously the dynamics and the epidemiology changes. But the only thing that she had was, instead of going once, she was going twice every day for about 10 to 15 days. And that, although that was like completely normal stools, no loose motions, no constipation, only the number of times increased, which I think I would have never checked myself. If that happened, I would be happy that that's happening. But that happened to be one of the, and they only found out about it after 2 months, because when she was going just twice a day, they didn't do anything about it. But like when it started getting more and more frequent after a month or two, that's when they investigated. And by then it had already spread a little. And unfortunately, she passed away because of bowel cancer. But that was quite shocking to me, because being a doctor, I wouldn't have ever taken that as a symptom that needs to be checked on. So I think the screening test just gives us a jump start at all of these things.
Thank you, Sumaya. Going back to cervical and breast cancer screening, how young should a woman start getting their cervical and breast screens done? Like at teenage or at the age of 30?
For cervical screening, it's 25 years of age.
Oh, that's young.
Yes, at 25 years. So it's just pap smear. It's something that you can do with your GP. It rarely takes even 2 minutes to get done. And now that it's self-test, you can, once you're 25, you can also do it by yourself. I think the kit would still be with the GP. Is that right? Or would you get the kit at home?
Yeah, so you would need to come to see your doctor, because that's something quite new to all of us, the self-collecting sample. So we'd love to sort of provide a little bit of guidance about how to do the sample.
Yes. Yep. And with the breast cancer, it's 50 years of age, unless you have a family history for breast cancer or any risk factors for breast cancer.
And talking about breast cancer, Sumaya, if breast cancer did not run in the family from previous generations, and all of a sudden my sister was diagnosed with breast cancer, does that mean that my kids, my children that's now part of their, hereditary signs.
Yes, yes. That's just something that they will have to get into checking earlier rather than waiting till 50 years of age. They would have to try and check earlier, at, for example, 40 years of age, or
Mm,
just have a chat with your GP. Some of them would recommend 35 and 30 years of age as well, but mostly it's after 40 to 50 years of age that we recommend, even with high risk in the family. So if a family member is affected, it's always a good option to be extra cautious. I think that is something that I've believed, even if you've not had it in your previous generations, but now you have it and we don't know what the cause is, it's always a good idea to consider it as a close family member being affected and having the breast cancer screening.
Now, touching on yes, go ahead, Patsy, if it's the question related to breast cancer.
This is related to the cervical screening. As you said, it's from 25 to 74 years old.
Yes.
Do you have to do that even if you don't have any symptoms at all at the age of 25?
Yes, and the reason is that, and that's why it's the screening test, because once we find something, we would obviously be investigating further. And because it's a screening test, it's something that's advised to do right from an early stage. And even with the cervical cancer, it's pretty similar. You might not have symptoms at the early stages. And not everyone has the HPV vaccinations as well. And even if you've had it, it just helps giving you an extra protection, but that doesn't mean that you would never have cervical cancer in your life. So it's a good idea to start early. At 25 years of age is the recommendation at this stage. And I think a lot of women are actually quite regular with, because every person I meet these days, they say that they have a recent cervical screening. And now that there's a 5 years of gap between your first and the next one, I think it makes it quite easier and something that can be done on every 5 yearly. I think that's a good thing.
So what's the process for this? Is that a vaccination? The HPV vaccination?
The HPV vaccine in Australia, they give it to they recommend it for every female around 12 years of age, 11 to 12 to 13 years of age. And most of them actually go in schools to give that vaccination.
Oh.
So, I remember
both
my children,
boys and girls are getting
both boys as well as girls.
Oh, boys too.
Yes.
Really?
Yep.
Yes.
But they don't have cervix though.
No, but they could still have the HPV viral.
Oh, I see.
So,
Okay.
yes.
And with the new test kit that the women can use, is that available in the chemist or
It is
still recommended by the
today.
GP?
It has just started today. So today is when it's released. Today is the self-collection day. So Yan will be able to help better to recommend whether, how is it going?
Yeah, so I think a self-collection is a really good option for a lot of us because a speculum examination is not something pleasant. So if people want to do the self-collection, they will need to go to see their GP to actually talk about what needs to be done. And also they can get the test kit. It's actually quite a simple, it's just a swab, like what we do with the COVID swab. So people can just get the swab and go to the, for example, go to the bathroom after the practice to collect the sample, or they can just stay in the doctor's room behind the curtain and they collect the sample themselves, and they can hand over the sample to their doctor for further testing. And that's just the process. So should be quite straightforward, but I think it's going to benefit a lot of women. For example, who don't like a speculum examination at all, or who, for cultural reasons, for other reasons, who just don't like internal examinations. Yep.
That is really a good information, because younger women tend to think that because they're young and healthy, they don't need this testing. So it's really good to put it out there and make people aware. Going to the topic of the balanced diet, Bernadette, one of our volunteers, is a pescatarian, and she asked in the chat group, what about, the pescatarians? And I have a few friends who are vegetarians too. So I guess they're missing out on the protein and the iron because they're not eating it. So you would recommend, based on your answer, Dr. Yanyan, is that they regularly take iron tablets?
I would recommend that, but that also probably I would also recommend to have a test before they start the supplementation. So we get iron mainly from the red meat. We get a little bit of iron from the dark green veggies. But as women, because of our periods, we lose iron every month. So a lot of us already have low iron, even if when we eat red meat regularly. So if we don't eat red meat at all, then we are more likely to have low iron. So have a test with your doctor, and if the iron is actually low, then you need to think about the supplementation.
And would you suggest, I've got some vegetarian friends who eat veggie hot dog, veggie meat, but they are not the regular meat. They're made of soy or meat substitute. So is that good, or it's still not enough protein and iron?
So protein-wise, they may be able to get enough protein from the substitute. For example, like a soybeans or the lentils would give you some protein as well. Tofu gives you some protein as well. I think it's more about missing out iron and some vitamins, which only exist in meat. So iron is one, and vitamin B12 is another one. So vitamin B12 is also important for our blood cells. So if they are vegetarian, many vegetarians would need to take a vitamin B12 supplementation as well.
But does iron tablets make you constipate? I thought they make you poo.
They do.
Poo more.
Yes, they do make you constipated. Yep.
So what would they do then? Drink lots of water and have more veggies, more fiber?
Yes, that's right. Fibers, veggies. And some people, even with that, may not be able to tolerate the iron tablets very well, or they simply don't absorb very well. So if the iron is still low after you have been taking the iron tablets regularly, then you need to consider whether you need to have iron infusion. But again, before you do that, you need to talk to your doctor, because there are many reasons for people to be low in iron. Not having enough red meat is just one of them. You may be low in iron because your periods are too heavy, or you may be low in iron because your bowel is bleeding from somewhere, and your doctors would guide you through what tests you need to do and what things you need to do to maintain the iron level.
There you go. I think, Bernadette, you have to eat steak from time to time.
Can I also just add that a lot of people taking iron supplements don't really know this, that you should avoid taking it with something rich in calcium. So you should avoid taking it with milk, for example. Try to keep at least 2 hours before and after taking milk if you're taking an iron supplement. So if you're
really?
Yes, if you're taking it in the morning time, you're actually reducing the chances of having iron absorbed in your body, because you might have a coffee or milk product immediately before or after that. So I generally tell a lot of women to have it in the evening or post dinner, and not to have anything that is rich in calcium just before or after that. But in fact, if you have something that's rich in vitamin C, like if you have it with a lemon juice or something, that will reduce the nausea, but at the same time, it will increase the absorption of iron, which the vitamin C helps. So oranges, lemon juice, and all of that will help in increasing the absorption. And a lot of people have noticed changes in their iron levels only by making those small changes, because they would generally have it immediately after milk, and then there was no absorption of iron basically. But when they changed the timing and they started sipping in more lemon juice with the iron, that really helped.
So even if they take soya milk, that still affects the absorption of iron?
I didn't know the calcium value in soy milk, to be honest. Yan, do you have any idea about the calcium?
Less than a cow's milk, but still soy milk has calcium in it.
Calcium.
Yep.
It's the calcium content, not
Yes.
the kind of milk. Yeah.
Yes, that's right.
Going to the presentation about exercise, I'm one of those guilty of not being very lazy when it comes to exercise.
You are not
Is
alone.
yeah, is housework considered exercise? Because you move a lot, you know, you vacuum the house, you clean the house, you're always on your feet, moving around, cleaning, cooking. Is that considered exercise, or you really have to do the walking, lifting? Convince me, Dr. Yan.
So I would love to say that's part of exercise. And I think they are. At least we are not sitting there for like 10 hours a day by doing housework. And I think, for example, vacuuming, that's a sort of a weight-bearing exercise as well, isn't it? The vacuum cleaner is not very light. It's pretty heavy.
Yeah, and Patsy and I look after our grandkids. So is that weight-bearing exercise, carrying the baby?
Definitely. Parenting kilo kids is definitely weight-bearing exercise. Yeah.
Thank you.
Yeah, so that's, I mean, doing housework, that's part of, that's one way of staying active. And I think that it's just the way we want to encourage people to do more exercise to a higher intensity, because it's very uncommon for us to get a little bit of puffed out when we're just doing housework, isn't it? If we feel a bit tired, we just have a rest and we continue. But we really want people to build up the resilience, the tolerance of their heart and their lungs by doing a bit more intense exercise.
Intense, that's the word.
So a bit more intense than housework.
Yes.
And I think that will also align with the fact that Yan has said that you need to try to get your heart rate a little higher. So although we are active during exercise, that would be considered minimal exertion as to what it's doing to your heart, because it's a regular thing. Maybe just pushing a little bit harder so that your heart rate goes a little higher than what it is usually is a good idea to maintain a good cardiovascular health as well.
Okay, so we have to run around and chase our grandchildren, Patsy, not just look after them, run around with them.
Yeah,
thank you for that.
Twice quicker.
Oh my gosh. Okay, there was something that you mentioned, the good tips on mindfulness, that really is new, and I think is something that we can take away. So with the mental stress, can you just repeat that, Dr. Yan, on the tips on mindfulness? The senses, you have the sense of smell, sight, taste.
Yeah, so eyes, ears, nose, mouth, and your hands and the feet. So that's like 5 senses. So you see a few things, you name them, you hear a few different sounds. So when you are really being there for yourself, you may be able to hear sounds that you were not hearing just now. For example, like a birds chirping, or vehicles outside your door, or just the dripping of the water in your house. You'll be able to hear those sounds, and use your nose to smell something, and your mouth to taste something, and hands and the feet to feel something. Yeah.
And the breathing, yeah.
And also breathing. you can practice the breathing as well. Yeah.
And do you recommend this for anxiety attacks? You know, I think one of the few things that premenopausal, I've had some friends who get anxiety attacks as premenopausal symptoms. So do you recommend this tip of the 5 sense being mindfulness to when you're starting to have a panic attack?
Yeah. So this is the 5 senses thing is just one example of all the mindfulness practice. So there are other ways to do mindfulness practice as well. So in general, yes, if people can realize that their emotions are getting high, then yes, I would recommend them to do the mindfulness practice before the emotions reach the peak, ideally, because when our emotions are already at the peak, it's really difficult to settle down. Yeah, so I would recommend that, and they can definitely try the breathing exercise as well. So
Okay.
yeah.
Well, thank you very much. I don't think we have any further questions. And as I mentioned, this is we've shared this on a few Facebook page, Facebook groups, so they can continue to watch it and learn from the presentation. Thank you so much, Sumaya and Dr. Yanyan. It's really been a pleasure. Oh, one last question from Elizabeth. Would you like to, yes, go ahead, Elizabeth.
Yeah, thank you so much, the two doctors, for the presentation, Yan Yan and Sumaya. There was a question I posed there, but it was answered already. For my community, we eat actually a lot of vegetables, but the only difference, we like to cook them a lot also. So that's why I was asking, if we are cooking it, do we lose his healthy level, or is it the same value when they cook it a lot like that? Because when you make it raw, nobody likes them, but they have to cook it until sometimes change the color. That's one
I'm
thing.
guilty of that too. I overcook my vegetables.
Yeah, it's culture things. That's one question. And then the other one is just a comment, maybe this kind of presentation, they are really good. We are running parenting sessions with the parent. And one of the things they requested is information about women health. We actually have been looking around of who can help us with that. It just nailed it when I was hearing what you are presenting. This is exactly what we want. How can we get this kind of information sessions? We pass it to our community. Or how can we get all of you or somebody who will help us do that?
So yeah, we will be very happy to facilitate the session for your community as well. So let me think what's the best way. Would you be able to type in your email address in the chat box? And I'll just ask our project administrator to send you an email. Is that all right?
Yeah, and Elizabeth, we found the WATERWALL project, which is the association that Sumaya and Yan Yan are from, through MiCare. So, but there you go. Elizabeth has already typed her email address.
Fine.
And
I can still connect with MiCare.
Yeah.
So that they will help us to do that.
Yes, they were the ones who introduced us to the WATERWALL project. But they also have a lot of topics, which includes, managing COVID at home, vaccination for young kids age 5 to 10, and a lot of information is we've had a lot of sessions done by in coordination with the WATERWALL project. So, which we are really very appreciative of your time, Dr. Yanyan and Sumaya. I think we have a lot of learnings today, me as well, that that I will hopefully start to practice. Thank you very much, and have a good evening, everyone. If there are no further questions, I'd like to end the session by saying magandang gabi po sa inyong lahat. This is Gawad Kalinga. Thank you very much for tuning in, and you can still watch this through the link provided in our Gawad Kalinga page and in Good Vibes Pilipinas. Have a wonderful evening, everyone. Stay safe, especially it's flu season. Eat your veggies and exercise. Thank you, everyone.
Thank you. Thank you very much.
Nice evening.
Thanks, bye.
Bye-bye.